Welcome to the Human 5.0 Project, the podcast where we cut straight to the breakthroughs that matter, the show where science meets self-optimization. I'm your host, Ultimate Biohacker 10X, and here we break down the real research, real data, and real dosing behind modern biohacking, from compounds and peptides to techniques, devices, lifestyle strategies, and performance protocols. Most people jump in and jump out before they get the gold, so we're keeping it tight and delivering the essential insights you need without the fluff. If you've taken the time to hit play, we'll make sure you walk away with valuable knowledge that can transform your approach to longevity, health optimization, and beyond.
Functional medicine is either the best thing that ever happened to modern healthcare or a magnet for overpriced test and protocol cosplay. So now we're doing the adult version, what functional medicine actually is, how it's different from conventional medicine, what it does well, where it goes off the rails, and how to use it to get real outcomes without getting scammed. Let's lock this one in. What's up, team? Welcome back to the Human 5.0 Project. I'm Ultimate Biohacker 10X, an MD with straight facts and zero filler. Disclaimer, this is for educational purposes only. I am not providing medical advice. If you've got severe symptoms, acute illness, suicidal depression, chest pain, neurological red flags, ER and conventional medicine first. Functional medicine is not suitable for emergency care. Cool? Let's move. Here's the clean definition. Functional medicine is a personalized, systems-based approach that focuses on identifying and addressing root contributors to chronic issues. Things like nutrition, sleep, stress physiology, metabolic dysfunction, inflammation, and environmental exposures, rather than treating only symptoms. Think of it like debugging a buggy app. Conventional medicine patches the crash. For example, painkillers for headaches. Functional medicine digs into the code. For example, inflammation from diet, stress, or nutrient gaps causing the headache. Core idea: your body is an interconnected system. Gut, hormones, immune, environment, all play. Functional medicine uses lab tests, lifestyle history, genetics, and nutrition to create tailored plans. It's not alternative. Many functional medicine practitioners are MDs or DOs who integrate it with evidence-based tools. Functional medicine shines in the gray zone where you're not dying, but you're not thriving. This is where it can be elite. Time and context, longer visits, deeper history, lifestyle, stress, sleep, diet, training, environment, pattern recognition, connecting symptoms across systems, fatigue and gut and skin and mood, weight gain and sleep and insulin and thyroid, autoimmune flares and stress and infections and nutrient status, optimization and prevention, not just normal labs, but insulin trend, inflammation trend, nutrient sufficiency, metabolic markers, body composition trajectory, personalized interventions, food strategy, sleep strategy, training plan, supplements, when appropriate, behavior change with measurements. Little evidence quick hit here. Cleveland Clinic's functional medicine program shows 50 to 60% improvement in chronic symptoms like IBS and fatigue, per 2025 studies. Functional medicine at its best is data and behavior and biology and time. So here's your pro tip. It aligns with biohacking, self-tracking labs for real optimization, like spotting nutrient gaps in my DXA scan. Let's kill the myths. Functional medicine is not natural means safe. Supplements can replace medicine. Everyone needs 47 labs. Detox your liver with a juice cleanse. Everything is mold, parasites, or Lyme. And it's definitely not diagnosing serious disease without proper conventional workups. Adult rule: the right order is rule out dangerous stuff first, then you optimize. Labs are functional medicine's double-edged sword. Powerful when targeted, wasteful when overdone. The truth: not every symptom needs 10 panels. Start with evidence-backed basics that actually change plans. High-signal labs, they're often worth it, per IFM 2025 studies. Metabolic, fasting insulin, A1C, glucose, this catches early resistance. Inflammation, highly selective C-reactive protein, that's a systemic signal. Nutrients, vitamin D, B12, ferritin. Common gaps in fatigue and autoimmunity are found here. Thyroid, full panel, TSH, free T4, T3, antibodies, if the symptoms fit. Gut, stool analysis if GI dominant, for example, calprotectin for inflammation. All right, how about the optional or controversial stuff? Only if the basics fail. Organic acids, we're looking at the urine for metabolic clues. Useful for some, noise for others. Food sensitivity, IgG, it's overhyped. Elimination diets often are better and cheaper. Hormone panels, saliva, cortisol, this is context dependent. Do blood usually first. Red flags. Advanced, in quotation marks, tests without clear why or result action. For example, a $500 microbiome without GI symptoms. Or in-house only test. See this as a conflict of interest. Here's the rule. A test must answer, what if it's high or low? How does that change my plan? If not, skip it. Evidence, overtesting adds cost without outcomes. And here's the skeptical section. Overtesting. Some clinics run massive panels with weak evidence for clinical outcomes. Not all tests are bad, but a test is only useful if it changes a decision. If someone can't explain why they're ordering it, what result would change, and what evidence supports the intervention, it's probably a revenue stream and not medicine. Oversupplementing. A 12-supplement stack is often a sign the plan isn't targeted. Supplements should be short-term, measurable, linked to a mechanism. How about over-attributing? Functional medicine can sometimes blame everything on one villain. Cortisol, gut dysbiosis, toxins, hormones. We've heard it all. Reality, chronic problems are usually multi-factor, and the best clinicians prioritize the biggest levers first. How about scope creep? Functional medicine should not replace oncology, emergency medicine, surgery, infectious disease management, psychiatric crisis care, etc. If it's serious, you need the right specialist. A little note here, expect costs. Consults, $300 to $500, labs, $200 plus, and budget accordingly. So you're considering a functional medicine specialist. Here's your decision framework. Step 1, start with the big four. Before any testing, dial in sleep, protein and whole foods, resistance training and steps, and stress management. If those are trash, labs won't save you. Step 2, use a minimum effective labs approach. Good baseline labs that often actually matter, CBC, CMP, lipids, ApoB, that one's optional, hemoglobin A1C, fasting glucose, fasting insulin, thyroid panel, again, TSH, free T4, add free T3 and antibodies if indicated, ferritin and iron studies, especially in women, vitamin D, C-reactive protein for inflammation, and then you expand based on symptoms, not vibes. Step 3, demand a plan that's measurable. Ask, what are we changing? How will we measure progress? When do we reassess? And what's the stop rule? Step 4, pick the right practitioner. Want some green flags? Okay, they talk about risk. They respect conventional medicine. They don't promise miracles. They use fewer supplements over time. They track objective outcomes. How about the red flags? Fear-based marketing. Everyone's got parasites. Sells massive supplement bundles only in-house. Refuses to coordinate with any other provider. Bottom line, functional medicine is root cause, system-based, and measurable when done right. When wrong, it's expensive hope. The 7-day challenge here is something to just give you a little bit of a baseline. Track your symptoms and the big four basics: sleep, diet, training, and stress. Get a baseline. Then decide on a functional medicine dive, if it's worth it. Drop me an FM if you've tried it, or root if you're thinking about it. I'll get back to you. For now, smash subscribe, stay rooted, stay restored, and stay resilient. This is Ultimate Biohacker 10X. I've hit my sleep and my diet so far today, but I'm out because I need my training so that I don't have stress. Thanks for listening to the Human 5.0 Project.
If you found value in today's episode, share it with someone who's ready to elevate their biology. Make sure to follow the show for weekly deep dives into peptides, protocols, devices, lifestyle strategies, and the science of high-performance longevity. Until next time, Stay curious, stay optimized, and stay 10x.